desperately wants to avoid the bitter experience last time when she lost her baby during her 9th month of pregnancy.
A week to that thing is happening, I went to General Hospital so that they test me, they tell me my baby is okay. They tell me I should go and do the scan. So I do the scan and return the scan that day. The nurse now tell me my baby is okay, everything is okay, but I don't know the thing, it just happened like that.
Adelabu's story paints a grim picture of the lack of investment in primary health care by local authorities.
There is dearth of facilities and even the personnel. You see a situation where you have 1,000 doctors in Abuja city alone. And if you go to all the area councils, you may not have up to 2-3 doctors.
Complications during pregnancy and childbirth have resulted in deaths of both mothers and babies.
Late presentation or delayed presentation is one of the things that's actually contributing to these complications we are seeing. And some of them also, they tend to deliver at home or even from in spiritual homes.
Specialized care like this is very scarce in rural Nigeria. And even where it is available, there are challenges.
So far, we've been able to infuse into the system about 4,500 midwives deployed to about 2,000 facilities nationwide. And the human resource component of the intervention really seeks to ensure that we provide skilled attendants at the point of delivery.
The scheme is meant to run for 2 years before local authorities take over. But with corruption and a shortage of facilities in rural areas, few pregnant mothers can hope for any change anytime soon.
Glad to know you're still there with us. 0802-836-8971 is still the number. All right, we'll start with your chooks. Infant mortality rate in Nigeria. Our children are dying. 1 child in every 5 seconds. That's an alarming figure, if you ask me.
You know, sometimes I have this feeling that our leaders don't think. Really, that's the way, as sad as it is. But that's what I feel, that they don't think. Because, you know, on this show once I said I would suggest some state governors sending their workers or their appointees or co to come spend time in Lagos. When you have a winning formula, you don't delay in duplicating it. You and I remember when Fashola did Mother and Child. I was thinking that by now we have taken it to the next level. If you check that statistics, you find that as in Lagos, it won't be that bad. Because what? Government took that move. They made the move to provide facilities strictly for mother and child. And I know how much they invested in that project. And other governors stroll into Lagos and they stroll out. And you don't think, okay, if this is working, why can't we replicate this same thing where we are? Because you find that some people, poverty, they can't access the kind of medical facility they need because of poverty, the cost of going to hospital. And then you find a situation whereby the only public hospital is almost ground zero. So what do you expect? Why wouldn't you have these cases of our children dying? If, you know, the other woman was saying something about we going to spiritual, you know, because what do you do? Really? What
choice are you left with?
You don't have money to go to private hospitals. The government hospitals are like
run down.
What do you do? So I really don't understand. Sometimes you sit down and you are looking at them, and God bless Fashola for that, because I think I said it on this show, and my wife just put to bed some weeks ago, and we went to a government hospital, the Baja Mother and Child. Everything, in fact, as much as they provided, like that Baja has about 4 generators, 4. different ones, apart from the national grid.
Okay.
So they're constantly on power.
On power.
And the place is well equipped. In fact, the last one is typically for newborn babies. You know, whether jaundice, whether you need to use incubator, equipped. The last floor. And they are like that in all the local governments. Why can't we just do the same thing?
I mean, I'm glad we're making reference to what Fashola did in his time. I mean, it shows that we're not just here to knock government every time. So when you perform,
we
you
say
know,
about
we
what
also
they
say
have done,
it.
and we're pointing at people that go and check what this
man did. Yeah.
I'm happy that, was it last month or last 2 months? Somebody told me, I saw a friend of mine in Lagos. I was like, what are you doing in Lagos? They said the government sent them to Lagos. And I say, that's good. That's what I've been saying on TV. That you people should be coming to some sort of IT to understand how things are done. And they were studying transportation. They were looking at Ministry of Environment. These are the areas they went to. They wanted to develop something like that in Anambra. Okay. And I'm sure they should also come and look at the health system here and see how we can do that. And once you begin to do things like that, individuals will come in. People will donate to you if you are genuine about it and they are seeing what you have done. I'm sure this Lagos thing, people, individuals and corporate organizations are putting money there because you see that this thing is working. And they have pegged the cost of even giving birth. Once you have birth, safe delivery, 23,000. You don't add anything to it. Whether you stay 1 week or 3 weeks. So people know that, oh, okay, we can go there and deliver and 23.
And you know what your bill is. Okay. All right. Okay. Mr. Akisoya.
The statistics that were read out are very scary.
Very, very scary.
You know, people, children dying, you know, 1 every 5 minutes. It's not acceptable. And I think for me, we have to go back to focus more on primary health and health education as well. Primary health in the sense that you do things that will prevent you from getting ill rather than going to the hospital to be cured. Let's be healthy and we don't get
prevention is better than cure, like you say.
So that's primary health. And I think, you know, there was a time in the long term past when Professor Kuti of blessed memory now, well, that was really his focus, and the results showed for it. And I think that's what government needs to do more about. Also, health education is key. Many people are ignorant, especially in the rural areas. Before you give birth to a child, you need to do all these antenatal, go through all this. But many people, they don't even bother about that until they want to have a child.
Because some of them don't even have money.
They don't have money, and so some don't know.
I've given birth before, let me do it.
Exactly, and they just think that having birth is just, you know, wants somebody to just bring out the child. Then there's a lot around immunization. There are so many that you have to go through a certain period for the child to be able to pass through that, you know, because
and be healthy.
And be healthy during an early period in life for any human being. And if they go through those ones, they are helpful, but many of them, they don't even go through them. Avoidable diseases, they just, you know, get there.
Maybe now that you raise this, sorry, I'm going to, so that I don't lose that thought. What happened to our primary health centers?
Yeah, I mean, focus.
What happened to all of them? Because I remember
people,
they were everywhere, in every local government, in communities, you have this primary health center.
And education. I'm telling you this in the picture, the implication of this, you need to do this, you need to do this at a certain time, you need to do this at a certain time. If you don't do this, what can happen? Because people are educated.
Before you even get to going to general hospital, you have to go to a primary health center.
Yeah. That's the closest to
the people. That's the closest to the people, but those things are not functioning anymore.
Facilities are not enough. And even the men are not there as well. So.
I've told you about one I went to that didn't have a thermometer. As small as a thermometer. As it is. Yeah.
I mean the first lady, the first lady of the country cried out, you know, going to supposedly, you know, the biggest hospital in Abuja and said there are some facilities.
Nothing.
You know,
there's nothing in our hospitals. So, I don't know.
Today, the primary health center in Surulere, the one by Asivia Academy, facing Eco Hospital, that's the one we are using.
Well, how is it now? Maybe it's still there?
Fantastic.
Okay.
Because the man representing Surulere constituency, what's it, Bajafemi Bajabiamila. It's part of the places that he's been putting money into.
Okay.
Also, Nigerian breweries, they were, the fact they sponsored the renovation of that place. If you go there, you see by Nigerian breweries, corporate social responsibility. Because you see, when you don't put all those things, you'll be overstretching the general hospitals. Ordinary to do immunization,
Yeah,
why do you
Exactly.
need to do immunization, which is normal? Go to primary health.
And I think while we're talking about those who have done well, we have to mention the Catholic Church.
Oh, fantastic.
The Catholic Church have, in fact, they've been wonderful in terms of, you know, trying to contribute to healthcare. You know, I do know that if you're privileged to go to any of the Catholic-owned hospitals, the experience is amazing.
You're even going far.
It's amazing.
What the Catholic Church has done now is that almost every Catholic church, at least let me talk about Lagos that I know. Every Catholic church you know in Lagos, there's a clinic inside.
There is a clinic.
Everyone, if you go to this one by just the one close by St. Leo, there's one there. You go to my SS Movement and David, there's one there. They always have them.
Yeah.
And if you see, this is part of the charity thing they do. It's not more about, it's about, you know, that first intervention. If there's any case, you could go there, then they take care of the situation before you can now think of.
Before you escalate.
Exactly.
Things.
Yeah, they've done so. I use a Catholic hospital. All my children were born in a Catholic hospital, and I will not go to anywhere else for, you know. It's just amazing. I mean, if a church can do that, I think the government has the ability, the capacity, and everything else to do much more. They should just do the right thing. All right, feedbacks are coming in. This one says everything is not okay in the hospitals, but I like Lagos State. They spend on health center, and they advise us to have original honey and linen to give the children. Anyway, it says, note, my 3 children were born inside a church, but they are healthy. Julius Peter, you were just fortunate. I'm not trying to say churches cannot, but you were just lucky.
They're not doctors.
Yeah. And he went on to say, it's just by God's grace, okay? And my wife do go to health center regularly. Okay. The one we go to is functioning in Igbo Lomu in Ikorodu.
I know that in Lagos you find some.
In Lagos, yes. Yeah. All right, let's take care of poverty first, then we can talk about infant mortality rate. Because if you check, the poorest have the highest number of children. He has a point. He has a point. Yeah, but then children, they are innocent. Helpless.
Bring them into the world to suffer.
Yes, and I think people need to understand that having children comes with a lot of responsibilities. You don't just have them because you can have them, okay? Yeah, so, but the government needs to do the needful. All right, we have one more topic to look at before we go today. This other one, Chikwendu from Ikpaja, says government should pay attention to health centers. The one at Abeson Estate in Ikpaja is surrounded by grasses. There's no doctor, only matrons and nurses. The place is so open that the children are exposed to cold and insects whenever they go for immunization. Okay, I didn't want to mention the name of it. This is the same health center I went to that didn't have a thermometer. This same one inside Abeson Estate where I live. So I think I understand what this person, the place is overgrown with grasses, it is true. They started rebuilding that healthcare center for I think a couple of years ago. It is still the same way, uncompleted. They are using it like that. So when it rains, everybody is hiding. It's in a deplorable state. So let whoever is in charge of that, if they are listening, please do something. I mean, how can you have a healthcare center without a thermometer? It's crazy.
I think I need to just add
crazy.
The last 2 topics that we discussed, the local governments and role, because most of these things, some of these things are actually the role of the local government.
And
yes. Virtually like they are doing nothing, you know, at least from.
They are doing nothing because the local government, as we have it today, they don't have anything to work with.
They only have money to pay salary. The other money is with the governors.
All right, let's move it along. EFCC Customs places Governor Fayose on watch list. I don't know why this topic is even coming now, because this has been on for a while. Anyways, the Economic and Financial Crimes Commission, EFCC, has extended its dragnet across the security agencies to ensure that Governor Ayo Fayose of Ekiti State does not escape before the handover date, October 16 this year. And among the agencies they've written to is Nigeria Customs Service. They've asked them to be on the lookout for the governor in case he attempts to leave the country. Anyways, reacting to EFCC's letter to the Nigeria Customs Service to monitor him, Fayose himself has come out to respond via his Twitter handle, and he says, and I quote, "Putting my name on the watch list after notification of my comment is not only political but petty. I'm not among those who are afraid to face tomorrow. Nobody is God. They should expect me on October 16, 2018. I will remain in PDP, not minding their intimidation." Barrister.
Well, I think it's because the personality that is involved, or the fact that we are in going towards election and all that, the way we take our politics in Nigeria. Otherwise, putting anyone that is suspicious on a watch list shouldn't be a big deal. If you think this guy, you suspect that somebody has committed a crime, and you are not able to deal with him now because of certain cautionary provisions. Yeah. Yes, you can say that he may want to escape because of such offenses. You haven't, by doing that, you can't talk about maybe slandering him or committing libel. You are just saying based on suspicion, you suspect this guy might want to do this. If he doesn't do it, fine.
No case.
There's no case. But you just say, be watchful. And I think Fayose himself, kind of originated the whole thing. He first of all wrote to them and said, so I'm ready to come and see you on so date and all that. Why do you have to start writing them? They are the law enforcement agents. If they have anything against you, they will arrest you once the immunity is over. They now responded and said, okay, you can come to us on so dates. And that led, from one thing to the other. If he has not committed any crime anyway, he has nothing to fear.
There's nothing to fear.
Yeah.
You think so too, Chooks?
I just think, sometimes Fayose tries to make things difficult for himself. That's the way I see it. He has a way of taking things beyond. If he has an invitation to you, or he blows things out of proportion, and which attracts unnecessary attention to himself. But maybe the angle I don't understand is custom. I don't know if Fayose has become goods that the custom will go and be intercepted. I'm sure custom does not arrest individuals going.
No, in case he wants to go maybe through the land border.
Is he going to enter inside container? Immigration that checks who moves around.
So I don't know.
In this whole letter, I didn't read immigration. So apparently,
well, they said one of the agencies written to. One of the agencies.
They didn't mention. The only one they mentioned is
customs. Yes.
So, I don't know whether he's planning to. After all, there's a precedence here now. And let me say, I tried to go to the border. And,
by these guys.
I don't know whether that's what the government.
The Nadeco guys actually escaped through the land border.
That's it. So maybe they are also being suspicious, and that could be. There's no smoke with that fire.
But then why is this coming after he already by himself said his tenure is ending on the 15th? So
I'm not standing in for anybody.
Okay.
But we know Fayose and his antecedents. When Fayose begins to write you later, you need to really sit down
and look at it. Okay.
This guy.
All right.
So I'm sure
he basically called attention
that's what I'm
on
saying,
himself.
That he has a way of putting himself into some, I don't know, but that's my opinion. Sorry if I offended anybody. But he has a way of attracting unnecessary attention. It's just like the Ekiti election. Unnecessarily, you went to national TV, I am the Fayose, the rock. If you come, I crush you. Oh, well, if you want to crush, then hold on. When they come crush, they fight.
People vote.
You make noise now. So when you do that, you attract unnecessary attention to yourself. So I think this one too, why are you writing them?
You are now saying,
You are not-
remain PDP.
Did anybody ask you those ones? You are just,
What has that got to do with
I don't even want to go into it, but the only thing I say is that